Hi, Dr. Hupchen. Thanks for hearing my presentation. So our new patient in room 24 is a 42-year-old man presenting with chest pain. He says the pain is in the center of his chest. It's kind of a pressure squeezing type of feeling. Says it radiates up a little bit towards his left shoulder. It's about a 6 out of 10 in severity, and it comes and goes. He's not really sure if there's any precipitating factors, but he says that he does feel a sense of like nausea and indigestion when it comes on, and he thinks it might be related to food. In fact, he's tried taking some over-the-counter antacids to help with that, and it hasn't really made a difference. Um, he does have a history of similar chest pain in the past, said he was seen here in the hospital for it, but isn't aware of any diagnosis that was given. He thinks that everything was okay with his workup. He doesn't endorse any past medical history. He says he's pretty healthy. He doesn't take any medications on a daily basis, and he's not allergic to any medicines. He is a smoker, but no alcohol or drug use. His physical exam is completely normal. His vitals were within normal limits. His cardiac exam was regular without any abnormal heart sounds. His lungs were clear. Everything else on exam was completely benign. He doesn't have any labs or anything back yet. The only piece of data I have is his EKG, which I will pull up right here to show you. So as you can see, he's in normal sinus rhythm, normal axis. I think his PR is a little bit prolonged, so he has a first-degree AV block. And then he's got this strain pattern that you can see on the inferior leads in 2, 3, and AVF, as well as in the anterior leads, mostly in V3 and V4. This looks exactly the same as his prior EKG when he came in. And like I said, I think it's just a strain pattern. So in summary, this is a 42-year-old gentleman presenting with chest pain. In terms of serious pathology, obviously we've got to think about cardiac stuff, but he's young. He doesn't really have much in the way of risk factors. He's had the same pain before, and everything seems reassuring. So I don't think this is a coronary syndrome. He doesn't seem to have any risk factors for like pulmonary embolism, aortic dissection. I think this is most likely GI from his description. And I'd like to treat him with a GI cocktail and an H2 blocker and see if we can get him feeling better. But I suspect he'll probably be able to be discharged and follow up he doesn't have a PMD, so we'll have to refer him to somebody for follow-up. Okay, thanks so much. I look forward to your feedback.